music has so many forms, and to use the power of music to connect with people who you don't know, who are not from where you're from, but to be able to make a real, genuine connection with them and share a moment in time with them and help them on their path. And if we can help each other, then I think we're doing a good thing. And we just choose to use music and the arts as a way of walking that path together.
Now, first person, get ready. Ask the question, what would I do when my love is away? Good. Part one.
Today's workshop is presented to you through a partnership. We had a grant from the Virginia Center on Aging to film 2 workshops so that we can replicate best practices in bringing arts to elders throughout the state of Virginia. And so this is being videotaped today, and we will have 2 portions to this workshop. And it was on the registration form. The 2 portions are going to be, we're going to have a little bit of classroom, an hour of classroom, and then 20 minutes of transition time and break time. And then when we come back, we're going to be seated in a horseshoe with elders. We're going to be interspersed with elders, and we will be singing with them, and we'll pass out some lyric sheets. And we'll ask you each to manage the lyric sheets for the elder that you will be sitting beside. We'll all have name tags, and because we're a pretty small group, we're hopeful that it will be a really socializing and enjoyable, happy small group experience. Yeah. So I want to thank our funders and just recognize that Virginia Center for Aging, the Virginia Commission for the Arts, Newport News Arts Commission also helps fund our programs here on the peninsula. Riverside has graciously given us this space, and thank all of you for coming here. I hope that you get some great information and take it away, share it with your peers, and know that this information will be available on our website after June, thanks to Jpixx and their videography. I'm going to let you tell them a little bit about your background, if you don't mind.
Absolutely.
And thanks again. Feel free to, there's a restroom here, there's water fountain in the back, right out the back door. Make yourself comfortable, enjoy this program. Thanks.
Thank you. So yes, as Marianne had said, I'm a gerontologist. So you might be like, what is that? I get that a lot. Gerontology is the study of aging, but we are the non-medical side of aging. So I am not a physician. In gerontology, you study the holistic aspects of aging, you know, all the parts of aging that we all deal with on a regular basis. So to me, gerontology is more about living. It's really about how we live as we grow older. And so that's kind of my perspective. I've been in the field of aging now for over 20 years. I've worked in nursing homes and assisted living communities. I've worked in the community. My area of specialty is people with dementia and something we call person-centered care. And currently what I do is I have a consulting business where I work with organizations and I help them to become more person-centered so that they can better support people as they grow older and as they grow with dementia. So that's me in a nutshell.
My name is Linda Teasley. I am a singer. I studied singing. I have a doctorate in voice. For 20 years, I was in the Navy Band in Washington, D.C. So I was a performer, did a lot of performing. Also have a music ed degree. I've done a lot of different things, worked with kids. And then several years ago, when I found out I got the GI Bill, I went to school for music therapy. So I became a music therapist. And I, too, work with a variety of different people, some in the dementia area. I work at Fort Belvoir with groups of some soldiers, some active duty, some dependents of the whole community hospital in an inpatient psychiatric setting. So, and that's also something music therapists do. So it's been, you know, a life's journey to this place, and it's a really nice place to be. So thank you for having me.
Great. Thank you. So you are in store for a great afternoon. I wanted to just ask, as we move forward, how many of you work in the field of aging? By raise of hands. Okay, so most of you. And how many of you are musicians/artists? Great. So awesome. So we have a good combination, all these different perspectives in the room. So that will be really neat to hear all of your thoughts. So I'm going to start off by just kind of setting the stage and just talking for a few moments to kind of put this all in context. And then Linda's going to take over and talk about why sing. And we're both going to kind of share some different thoughts from our different perspectives. But I wanted to kind of start off by talking about what I think this all means, I guess, and like a bigger, broader level. So I think we can all agree that music, singing, is central to our lives, really. You think about from the time we're born, right? We sing lullabies, we hear lullabies. All of our family celebrations in life are often associated with music and singing. In school, we sing. Sometimes we sing before we can make sentences. And throughout our life, this is such an integral part of our lives that no wonder, as we grow older, it holds such an important place in our daily lives. So I think that that's an important thing to recognize, is really how central this is that we're talking about this. And also that it's not just from a clinical perspective. This is about life. This is about something that we all can do, that we all participate in. And I think that's one of the things I love the most about singing and music and talking about this in terms of as we grow older, because it's a way of connecting us. It's a way of connecting us with each other. It's a way of people connecting to the world that sometimes they might feel like they're not a part of anymore. And I think that what's amazing about music and singing is that it builds community. When you're a part of a group and you're singing, you know how that feels, like you're a part of something. And that's such an important feeling, I think, for elders who often are at such risk for isolation and loneliness. This is such a great tool that we can use to bring people together. And I know in my work, working with nursing homes and assisted living communities and all sorts of folks all across the lifespan, that I see the power of this all the time in many different ways. I hear on a regular basis how a CNA sings Amazing Grace to the person that she's caring for, and that's what allows her to give her a bath. I see people in advanced dementia that can't say a word, but they can sing a song. And I think that's the power of this. And so that's what we're here to talk about, is how do we bring this, right, to the lives of the people that we care for. So I'm going to hand it over to Linda, talk about why sing.
Why sing? What do we think? Singing, as all those the factors that Sonya mentioned, is a great exercise as well. And so these are some these are some things you may have never thought about. Physical benefits of singing. We need breath to sing. You need breath to speak too, but we need more breath to sing because we have to sing over longer phrases, musical phrases, and we want it to sound a little bit louder sometimes too. So increased breath support means that we take in more oxygen. As we take in more oxygen through our bloodstream, it goes to the brain and we can think better. Aerobic activity, this is all physical activity. It increases endorphins. Everybody knows what endorphins are, the feel-good chemicals. And it also can reduce stress hormones. So if people are agitated, as you were mentioned, taking a bath, somebody in deep dementia who doesn't want to take a bath, and the CNA sings Amazing Grace and then is therefore able to get her to take a bath. So it serves a function of redirection as well. Then the psychological benefits, the endorphins, of course, release positive feelings. It can decrease depression and anxiety. You can feel the support of others. All these Sonya really mentioned. Focuses on the act of learning means if you're learning, maybe you're learning a new song, or you're learning a new part of a song, or even just looking at the lyric sheets, your brain is focusing on doing something else other than whatever it is you happen to be thinking about at the moment or dwelling on. So it helps you think about things in a learning aspect that you haven't thought about before, that are different. Self-expression, of course, all the arts are increased self-expression. And music equals emotion to me. I think that's its strongest attribute, that it, and how it can can touch all our lives is that it translates into an emotional feeling, an emotional expression. It's just kind of how we feel things. And socializing, of course, it's a great socialization tool. If people work together in a group, they're working towards a goal. Maybe it's a performance, maybe it's not, maybe it's just singing together. Socializing also within the rehearsal, singing rehearsal, is also a really good way to get to know the people that you're with. Okay.
Okay, so other benefits. Benefits for your organization. So you had said many of you work in organizations that support elders. So if you need like a case, of why this would be important for your organization, here are a couple of things to kind of think about. Is that, like I had said, music is about connection. So it's really much about building these relationships. So what do I mean by that is it builds relationships between the people that are caring for elders and the elders themselves. So if you have people that don't know each other that very well, and actually may come from very different backgrounds, from very different cultures, from very different times, ages, this is a way of connecting. So this is a way, I hear from administrators a lot, I hear from directors how difficult it is for staff to connect with residents sometimes. This is a way, of connecting. So it's a great tool. Purpose. This gives people purpose. So lots of times we really, I think one of the struggles we have with elders, especially living in long-term care and in environments like adult day, is we feel like we're afraid they're gonna be bored. We're afraid they're not gonna have anything to do. Well, this is something that they can do. And it's actually, something that's fairly easy to do, actually, too. It doesn't require a lot of resources. It helps us know the person, know the elder. So one of the other bigger challenges we have when elders come into our organizations is we don't know their history. We don't know who they are. We don't really know who they are in terms of what they like and don't like. Music is a window into that. You can learn a lot from someone about what type of music they like, about what, even if they can't speak, to observe, right? What kind of, they move to, what makes them smile. This is really helpful information for us about what we know now about a person. It reduces distress. So I personally am not a big fan of the terms agitation and aggression when we talk about people with dementia. And the reason is because I feel like that those are often very normal reactions to situations in which the person is in. The reason I think that music reduces distress is not because necessarily in the moment it stops the person from being upset. It's because it increases well-being. And so what I mean by that is if you have a person who lives in your community, who you serve in your adult day, and that person wants to go home, right? They want to go home. They just keep telling you, I want to go home. If you run up to them and start singing in that moment when they're really upset, chances are that's not really going to help them meet their need. Because their need is security and fear and all these different emotions. But if we have music be a part of people's lives on a regular basis, it creates security. It creates comfort. And perhaps the person is less likely then to say they want to go home. Does that make sense? So it's not like a reactive thing to me. It's a proactive thing that we actually do all the time. And that's what I mean by well-being.
I did my internship, music therapy internship, in an assisted living community. It was assisted living and memory care. But I found when you mentioned relationships between the CNAs, between the staff, and the residents, I found that was off the charts. It was excellent. People this is in the DC area. Most of the caregivers were not from the US, and they shared relationships with the residents so beautifully. But between resident to resident, there was no interaction. And it was really frustrating for me as the music therapist, to try to get them involved in music while they were not really involved with each other. So they were just there to see a show or whatever. But it also can help with the right kind of guidance. I think people build relationships among each other. And if a day center, I guess, is a bit different, but this is a residential facility, and that may be something that you see more there?
I'm so glad you said that, because I think you're absolutely right. Like, between elders, sometimes there's not a connection, and that's another way. And there's actually been a number of studies now that have recognized this, that when they look at interactions, that there's almost no interactions between elders and long-term care. It's always staff to resident, pretty much, and very little resident to staff.
Right.
Yeah, so I love that. Yeah, absolutely. I think you're absolutely right. So just to say a couple things about this, to more build the case of why this is important, is we've talked a lot about well-being in gerontology. This is something that we're really trying to more talk about this rather than the negative. And this is a model that was developed by the Eden Alternative, which is a model of culture change, and Dr. Al Power. And it basically talks about, these are human needs that we all have, every one of us, to create well-being in our lives. So when you look at this, and I can read them because I know it's a little small, I mean, music and singing fulfills all of these needs. You know, identity, who we are, what we like to listen to, what's important to us, connectedness, like I said, you know, connecting with people, security, you know, that idea of belonging to something, autonomy. I can sing, it's my voice. I can choose when to sing. That's very powerful. Meaning, it's important. It gives meaning to people. Growth, it could be something new. It could be something that I'm learning. I'm new. I'm 100 years old, and this is new to me. That's great. That's important. Joy, self-explanatory, right? So all of these well-being needs are met by this one seemingly simple thing, right? The last thing I'll say is this idea of salutogenesis, which I love this term. So salutogenesis is a different way of looking at, I guess, health, medicine, healthcare. And it's this idea that we focus more on well-being and wellness than on the medical aspects of disease. You know, and so I love this because isn't that a great way to look? I mean, isn't this what really is important to all of us, is living well? So music, singing fulfills this. It's a way of operationalizing this, putting this into practice. Is salutogenesis. So salute. I'll pass it over to Linda again.
Oh, okay. Singing and aging, these are some physical things that happen to us and to our voices as we age. We can lose stability. We can lose our sense of balance. We don't have as good a balance as we used to have. And that can happen with the vocal apparatus too. Loss of fine coordination, that also happens in the voice. We're not able to coordinate as well as we used to. These are all exacerbated by hearing, of course, is a big one, or visual changes, and other medical conditions such as dementia, stroke, Parkinson's. Expressive aphasia is one that stroke patients have a lot. And drugs, medications affect all these things too. They affect the balance. They affect muscle coordination, and also if you have, I think this may be in a later slide too, if you're taking medications, blood pressure medication is a diuretic, or you're taking anything that gives you dry mouth, this is your instrument, so that's going to really affect that as well. Okay.
So I go ahead of you.
And these are some of the things that happen to our voices as we age. And I thought these were interesting. Men's voices tend to go higher. Is it true? These are all, yes, since you were a teenager, these are all generalizations, so they don't happen to everybody. Lower pitch in women, I think that's fairly common. A thin voice, and what we mean by that is just a voice that's quality-wise thinner, maybe more difficult to hear. Reduced vocal endurance, you may not be able to sing like that Amazing Grace, how sweet the sound. You might not be able to sing that whole thing. You might have to take a breath in between because you just don't have the stamina. Tremor, shakiness in the voice. Certainly if we're dealing with Parkinson's people, that can be an issue, but that can happen to all of us too, just from any physical issues that you might have, and just the loss of the breath control. Okay, so then talking about vocal damage, this gets a little technical, and if you have questions, you may raise them after we're finished or now or whatever. Vocal fold hemorrhage is just a burst blood vessel on your little vocal folds. And we'll have a picture of those later. Nodes are calluses that are rubbed into your vocal cords, vibrate really fast together, and that's how the sound is made. If we're doing it improperly, we can rub a callus, just like you would on your hands, on your vocal fold. And they're made up of tissues. So they're made up of, they're not skin, so it's kind of difficult to get rid of those calluses. Vocal fold paralysis, you might see somebody has a hoarse voice, a breathy voice. These are all the causes. Breathiness and hoarseness are symptoms that if you hear somebody who has a very hoarse voice or even a lot of breath in the voice, there may be one of these things going on. And the vocal fold paralysis, you can have one that's paralyzed and one that's not. And it's not permanent. None of this stuff is permanent. There are ways around all these things. Mm-hmm. And so I already talked about hydrating. Mm-hmm. That's very important. Good physical shape. You have to be able to get the breath in to take these phrases, sing these phrases. Good dental hygiene. Your mouth is your biggest resonator. That's kind of where all the sound is percolating and then it comes out. The shape of your mouth, the shape of your teeth. If you have teeth, if you don't, if you've got a plate or something, that's gonna, and you take it out, that's definitely gonna affect everything. And then regular singing can improve communication, spoken communication, nonverbal communication, because it's all about expression too. All those.
Absolutely.
Okay, here we go. If you ever wondered what your little vocal cords look like, you can kind of see, they call them vocal ligaments and vocal fold and all these kind of things that are in your larynx. If you put your hand like right there, when you're talking or humming, that's where they are. So they're in there. This is your larynx, your Adam's apple, and they fit in, they're attached, you can't see from that picture, but they're like a V. They fit in like that. And when we are taking breath in, they open, because you can't speak when you take the air in, or you shouldn't try. People do try. Call that the vacuum cleaner technique. So they're open when you take the air in. They're really important function in your body. And then they come together when you sing or speak. They vibrate at a faster than light speed. They vibrate very fast. And as you sing, if you sing higher in pitch, they're like rubber bands. If you stretch a rubber band, the pitch is going to get higher. That happens with your vocal cords. If you relax the rubber band, it's going to be lower, and that happens with your vocal folds. And one more little thing. A woman's vocal folds, vocal cords, can fit on the head of a penny. They're that small. Wow. Men have slightly bigger ones that can fit on the head of a dime. So that's why we talk so much about breath, is because we've got to support these little guys because they're just really teeny tiny, and it's not easy to hurt them, but it does happen.
Wow.
These are just some of the ways that people with dementia, people with Parkinson's especially, stroke victims, the expressive aphasia, these are all music therapy techniques. So if you have questions about us, they're included in a handout too that you'll get later. But if you have questions, you may ask them. Okay, singing and dementia. And I think a lot of you probably had some experience in this arena. And we've kind of all spoken about this before. It's a fully engaging activity, and it's fully engaging on a couple of different levels. Music is a whole brain activity. So if you've seen, if you know someone who stutters, they're not going to stutter when they sing. It doesn't happen. And so that's a way to work with people who stutter. People who have had significant brain damage. If you know Gabby Gifford, who was the congresswoman from Arizona, if you go online or go on YouTube and just look up Gabby Gifford music therapy, you will see amazing stuff music therapy that they did with her. They taught her how to speak again through her vocal, through the places in your brain where music happens, which is all over your brain. So if you have an issue on one side of the brain or another side of the brain, just as long as they're both not damaged, the other side can take over via music and learn how to function as the side that's been lost. Mm-hmm. It's also fully engaging because you're engaged in learning music, you're engaged in meeting new people, you're engaged in activities that you may not have ever done before. And it works throughout the progression of dementia. So early, middle, and late stages. Even people in late stage dementia especially react to rhythm. There are 3 musical elements. We've got melody, harmony, and rhythm. There are more than that, but those are the main 3. The last kind of musical sense that we lose is the rhythmic sense. And the last physical sense that we lose is hearing usually. So you don't know what people are really hearing, even if they can't speak to you. But musically speaking with dementia, the rhythm, getting them rhythmically involved, tapping or something, is something they'll remember, other than the other things. Facilitates memories, of course. We all have favorite songs. We sing the song and we feel like we're back someplace hopefully pleasant. And as lots of the people that I worked with in the assisted living facility would want to sing songs that were way older than their years, things that were written in the late 1800s and folk music, and that's what they really enjoyed. And I asked a lady once, I said, well, why do you like this? Because we were told as music therapy students, you choose music from their age when they were young adults, which is good too. But she told me, oh, we really love these songs because our parents sang them. That was my father's favorite song. I learned it in school. So any kind of music, it can really help. This is kind of a technique that you might use with a dementia person. If you have a song that they know or that everybody knows, like "You Are My Sunshine," you can leave out the word sunshine. You are my, and they hopefully would sing sunshine back to you. And because that's repeated through the whole song, even though it's a short song, they can hopefully sing sunshine every time. And so you have to be sure that you don't overdo, don't overload people with too much stuff. So keeping sessions 15 minutes, 20 minutes, and then do something else. 20 minutes is a long time, actually.
Absolutely.
Yeah.
Absolutely. A couple other things about singing in dementia is, this quote is from Richard Taylor, who is a person who lived with dementia. And Richard taught us a lot about the experience living with dementia. And one of the things he taught us is that how much he did not feel like a whole person. And I really do feel that music and art is a way of helping people feel whole again. And I even argue all the time that is our #1 task, as professionals and care partners, is helping people to feel whole again. So I think this is a really important way of doing that for people with dementia. I think it's also, we do have to recognize, as Linda has said, is singing is a form of communication. And this is a still shot from the movie Alive Inside, which is an excellent documentary if you haven't seen it. And it talks about a project called the Music and Memory Project, but it's actually it's really about connecting with people through music. And this individual in the movie talks about how, I think what she says is something like, when I hear it, it makes me alive again. And it's just a power, because it's not only a way of communicating to people with dementia, but it's a way of allowing them to communicate with us and have their voices heard and be noticed. Because again, like Richard Taylor tells us, he feels like he's not noticed anymore. And when you sing, you're noticed, and people hear your voice, and that's powerful. So I think it's powerful in that respect. A couple of communication tips. I think, these are somewhat, I guess, basic knowledge, but worth repeating. is any time, that we're with somebody, with an elder, with a person with dementia. I would probably even argue anybody in an interaction, that there's probably some things that we can do to make sure that that interaction is like at its best, right? So specifically when we're talking about elders, I kind of just wanted to highlight a couple of things that are really important, is really making sure the person is ready for that interaction, So that means like their glasses, they have their glasses, they're clean. I don't know, I see some of you wear glasses, I wear contacts. I know that if I do not have my contacts in, it is very disempowering when someone is talking to me because I really can't see them. So, it puts you in a frame of mind right away that you are just kind of frightened. So it's something like that simple. Hearing aids. If people have hearing aids, to look and see whether they're on, whether they want them on. Some of the older hearing aids are not good when there's lots of noise around, actually. So if you're with a lot of people and there's lots of noise, they may not want their hearing aids. But the idea is making someone ready for the situation. Like Linda had said too, is not only the actual activity could be overwhelming if it's too long, but the environment. So if you're singing with someone, if you're in some way interacting with someone, and there's all sorts of noise going on around that person, it's going to be really difficult for them to focus on what's happening right there in that moment. It's just, as we get older in general, it's more difficult for us to multitask. That's how our brain changes. But particularly if you have dementia, for example, it's really difficult to focus on things happening at the same time. One of the things I really recommend is that when you're talking with elders who especially are sitting or in a wheelchair is to get to their level. It's actually even best to get below their level slightly because it gives them more power in the situation. It is difficult. If anyone who's ever had someone talking to you, even in restaurants, you can imagine, if you had to talk to someone like that for the whole time, it would be kind of annoying. It hurts your neck. It can be really just it changes the dynamics of the relationship. So to sit with someone whenever possible, be at their level, eye contact. So important. Tell someone, I notice you, I'm here with you, I'm giving you this time, even if that's not the way you're feeling, but to give people that sense. And in terms of initiating these activities, sometimes things like just doing it is a cue to someone that this is what we're doing. So if you can't, with language and words, express to someone like let's sing, just to start singing and to kind of model the behavior that you really want to see from the person. So just a couple of tips there. The last thing is the idea of knowing each person. So each person, each one of us are unique individuals. We have different tastes in music. We have different styles of music. I would even venture to say some of us do not like to sing out loud with others. Some of us like to sing in our cars and our showers, myself included. So, to know each person and understand what their strengths are, their weaknesses, their limitations, and to honor those. For some person, it might just be sitting and listening and tapping their foot. Another person actually wants to sing. Another person's just humming. One person might just want to say the same phrase over and over again. And that's all okay. All of those things are okay. But each person we have to kind of know and know what's important to them.
One little add-on to that, when we're talking about eye contact, names are important. If you're singing a song like He's Got the Whole World in His Hands, He's got Miss Sarah in his hands. People who, especially dementia people, especially if they're nonverbal, they're just, like they're asleep or they're just sitting there staring off into space, you say their names, you sing their names to them, they're going to hopefully react. Most times it does happen, so that's really important too. Absolutely. Okay, choice of music is important. And I was mentioning people liking music that was much older, that their parents would have heard, that they heard in school. That's one way to go. Folk songs are always good. Popular hits where I've worked are Bicycle Built for Two, Daisy, Daisy. Oh, Susanna, Danny Boy is also a big favorite. Then if you popular, as the baby boomers age, we have more and more interesting music we can do. So music of their, in my opinion, which I probably shouldn't say, but that opens it up to early rock and roll, that Elvis Presley, that kind of thing. Any early rock and roll is in what we call the blues form. It's a very simple form to do. You can help them make up songs using the blues form. They can come up with phrases and you can fit them into a blues very easily. The singer-songwriters, Carole King, James Taylor, Our other ones, and rhythm and blues, rock and roll, Motown, folk, rock, are all good things to get baby boomers involved in things. And also very importantly, no matter what type of music you change, you should vary the tempo and dynamics of what you choose. If you're doing a whole choral rehearsal or sing-along, all the music should not sound alike. You should have maybe something fast, something medium, something slow. And it really depends on the people that you're working with too, and whatever they're feeling at the moment, if they're feeling like they want to calm down, or if they're feeling really excited, and that kind of thing. Other things that,
I'm sorry.
oh well,
You want
there are a
to-
couple of other
Okay.
things. You can sing simple parts, teach simple parts to people that fit together so that they have the idea of singing in harmony with other people. Around, like row, row, row your boat, that's everybody knows that. When you have two groups singing that at the same time, people are not singing the same thing exactly at the same time. So that gives them an idea of what it would be like to sing in harmony. You can also add separate parts to different types of music, so that one group is singing one group is singing one phrase and the other group is singing another, and they kind of fit together. They don't have to be difficult, but depending upon the abilities of your group and the experience, you might be able to sing choral pieces of 2 and 3 parts. And another point that's good for people to be more involved is to invite family members to choir rehearsals or sing-alongs, and have them sing with their elders. And most importantly, do not choose music that is too high or too low, range-wise. Like the national anthem is, I have no problem with it, but it's kind of rangy, so you probably want to stick with something that's easy for everybody to do. So, okay, well, let's do some warming up. What the straw helps you do is kind of be aware of where the breath is happening. And you've all heard the phrase diaphragmatic breathing, probably. Your diaphragm is right here. Lots of people think you need to have lots of muscular stuff going on in your lower abdominal area. You do not. It doesn't really have anything to do with it. It's all kind of around your waist, so it's easier to feel what's going on. So if you take your straw and take a breath in through your nose or your mouth, it doesn't matter. Maybe mouth is better. And then blow that breath out through the straw. And then take another breath. So what part of your body was involved with that? You should feel movement around your waist. Does everybody kind of feel that? With the straw, it makes you do it. Okay, so you can put your straws down, but keep them for later, because I'll depend on you to help us with that. And vocal warm-ups are important to include in any kind of singing program that you want to do. So we've talked about the breath. Now let's kind of warm up the rest of the body. So if everybody will sit with their feet, if you can, on the floor. Because sometimes we're short and our feet don't touch the ground, and I understand how that is. And you want to feel, this is important because you want to feel grounded in space. You want to feel, not the earth move under your feet, but you want to feel the earth under your feet. So that's your foundation. This helps with balance, vestibular balance, which we lose as we age. And put your hands right here. So let's try without the straw this time to take a breath in through your nose, and I want you to blow it out as if you're blowing out a candle way on the other side of that wall, and make it last as long as possible. And then when you're out, you just naturally release here and take more air in. Now let's try that and we'll do some warm-ups with the neck, because this all impacts. If you've got a lot of head, neck stress, jaw tension, all that stuff affects your voice. Just take your head and roll it around to the right and the left. Don't roll it all the way around. So just in the front. And then go up or down, and then up, down, and up. Good, and then look to your right, look to your left, look to your right again, and your left. Good. Now let's roll your shoulders, either forward or back, doesn't matter. And then change the direction. If you were back, go forward. If you were forward, go back. Good. Okay. Now let's try. This is something that seniors may not be able to do, to lift their arms up. But if they can lift their arms up a little bit, it gives you it's another good foundation for the breath. So if you take it in, lifting your arms up, and then blow it out. Or you could do this. I saw you doing this. This is good. Take it in and let it out. Good. You all look wonderful. When you're taking it in this way, though, try to leave those shoulders alone. So we work the shoulders out, but we want to keep the shoulders relaxed and down, because the tendency is going to be for people to breathe too high, and you're not going to get enough air in. Okay, now, keeping your hands here, let's do a couple of what we call vocal glides or sirens. So we're going to start with wee, take the air in, and then just wee. Very good. And then when you're out, take a breath in again. Whee! Very good. Okay. And then, does everybody feel stuff happening there? Okay, then we work that into singing. We're just going to go down. This is you. Okay. That's the men and the women. So I want you to sing wee. Wee. Good, take a breath. Wee. Good, make sure your belly's moving. Wee. Good, leave your shoulders alone. Wee. We'll try one more. Wee. Very good. Okay, let's try this one. So let's try me, 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 me. Let's start a little bit lower. Let's start where we left off. So right there. Ready, go. Good. Me, 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 me. Me, 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 May, 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 May. So me and May, the me in the month of May. Me, me, May, 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 May. Good. Breath. Good. 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 Couple more. Sounds good. Nice, deep, relaxed breath. One more. Good. Was that comfortable for everybody?
Little high, little low.
That's well, if you read music, that's middle C for men and the C above that for women. So that's kind of a good range to pitch your songs at.
So we're going to just talk for a few minutes about inspiring participation. So how do you inspire people to join you in singing? So I know Linda has a couple ideas to share, and I have a couple ideas, and then we may not have. We'd like to hear your thoughts. We may save that to after this afternoon, and then kind of have a conversation more about it. So go ahead and just share us with us, Linda.
Oh, okay. Ask about their favorite music. What would they like to sing? We've already kind of covered this before. So ask about what their favorite music is and take suggestions from that list. You might want to pass out a list to people that has a whole list of songs, just a wide variety of music, and have them choose the things that they'd like, or have them write in something that they'd really like to sing. Those are all good suggestions. And it's good to vary the genre of music, because not everybody's going to all like the same thing. So you might want to do a rock and roll song. You might want to do something that's more country. You might want to do Broadway. People like Broadway music. And folk music is always good, I think. And then, of course, whatever more popular music you want to do, like some Carole King, or would be wonderful, or something like that.
But, yeah, absolutely.
Okay. And then encourage, we also talked about this, encourage the staff to participate, which I think they normally do. But really, if they're, excuse me, not from this country, a lot of the people that I worked with in this assisted living place are from Ethiopia, like a lot of them. Ask them about their music, ask them about their musical culture. We had one guy that would come in, he worked weekends, and he would come in and he would sing and he would dance for us. So a great mix of cultures, blending of cultures. Older people are probably not as used to seeing people from our vast melting pot that we have now, and it's good for us all to understand and be exposed to each other.
Absolutely.
So
yeah, and I think sometimes what I do see is it's assumed that only people in the activity department are going to be involved in these types of activities. And I think, again, we all can sing, we all can participate. So to really encourage everybody who's a care partner to be involved in that, this does take sometimes actually creating the possibility for that to happen so that staff feel like they can sit down and sing with someone for a while. And that's kind of the job of the leaders, is to create that expectation that that's okay.
If you have men just are not encouraged to sing, except for Eddie and some others, because it's not a masculine activity. That's kind of what our culture says, which is totally wrong. Other cultures, it's not like that.
Yeah.
So that's another example. To get them to join singing groups is more difficult. Statistically, there are fewer men. So you got to take that into account. Everybody knows that. But encourage them to join. If you have a veterans group, if you have a men's group in your facility that meets once a week, go up and sing some songs for them and say, oh, we'd love to have you participate. Sing military songs, sing Anchors Away, sing the Navy, the Navy hymn. They're two different things. I was in the Navy, so the Army song, I don't know what they call it anymore because they changed the words. Marines hymn, go sing all those things. If you sing that kind of music too in your chorus, then that's something special for the men. It's special for some women too, of course, but it's very special for the men.
Yeah, do you find, Linda, that it's more effective to have a separate men's, kind of all men together, or have you found success with mixed groups, or I'm just curious?
Well, I've done more work with mixed groups, but I was thinking, because there was a veterans group that met at the assisted the assisted living was in a whole huge retirement community, and it was independent living, and the men's group was anybody. So they met like one morning a week. It had breakfast, men's breakfast, and I always thought going and singing for them and inviting them to be part of that. I think they can, particularly elders because, like the curves phenomenon,
Yeah.
only women want to go to curves because that's for women, and you can wear whatever you want. You don't have to put makeup on. You're not going to the gym and going to sweat with the guys. And then the men, you're lifting weights and all that stuff. So it may be, I don't know.
Yeah,
It's a cultural thing too, certainly.
Yeah, sure. Yeah, interesting. Sure.
And so one other thing I would suggest in the rehearsal time is taking time out to socialize. Maybe you want to take a snack time. An hour or 50 minutes is a really long time for people to sit. So let them socialize. Another good way to stimulate socialization between them is to give them time to socialize.
Absolutely.
And then if you have a group that you feel wants to perform for others, there are many different ways to do that. They can perform for each other. They can perform for different people in the facility, wherever the facility happens to be. You could invite family in. They could perform for family. You could have a choral festival. You could invite other choral groups from other retirement facilities or churches in to have. You could, if your facility can do that, support this festival to get a lot of people involved. And but people may not want to perform, and that's okay too.
Maybe I just had an idea when you were talking.
That's
so many
all this is
times,
brainstorm.
yeah. And when you have one, I gotta grab it quickly.
Yeah, that's true.
Something I see a lot is, especially in nursing homes, assisted living, if there's a special area for people with dementia who live separately, is the people who do not have dementia want nothing to do with the people who live with dementia, right? Well, maybe that's an opportunity to kind of come together too, is for the, for different groups of people to perform for each other. So people who don't have dementia to go in and get to know the people with dementia and perform for them in a very normal kind of way, and vice versa. So that could be a really cool way of kind of equalizing.
They would always bring the the reminiscence, it was a sunrise, people up to the assisted living who could deal with and who would like this performance or like the music group, whatever we were doing. And it was Veterans Day one day, and we were singing a whole bunch of, mainly I was singing, a whole bunch of, because they did not participate, of World War II songs. So I thought, well, they'll like this. So I was singing this song called Coming In on a Wing and a Prayer, if anybody knows it, you know it. Well, I didn't know the verse part very well, the bridge. And so I was just gonna kind of speak it through. And one of the reminiscence, the dementia people, ladies, started singing it in a really loud voice, and I was just astounded. And I took the mic and I just put it in front of her. I said, "Sing it, Vicki, sing it." And she was she had a beautiful voice. She loved to sing.
What would you think if I sang out of tune? Would you stand up and
Before we sing, we've got to do what to our voices? Warm up. Oh my goodness, you guys are so smart. So we're going to do some warm-ups. So take it in and then out.
Today, we provided a workshop about singing with elders for health and wellness, and I think the context that we presented in was also about the idea of connection and community with singing.
Take it down, take your head down, and look up. Not too far.
Good. Part one.
Down.
There's so many ways that we can use singing as a tool to connect with each other and to build communities with people who are aging, with people who are growing with dementia.
Now we're going to sing. Ready? Take a breath. Ready? Sing. We, me, 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 me. I'll take another breath. Me, 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 me. You sound beautiful. Take another breath. Me, 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 me. Very nice.
It's always important to have arts organizations,
Take your time to
particularly
breathe.
for people who might not have experiences in the arts and they might not get them any other way.
Let's do this. What we're going to do is have half the group sing Hound Dog and half the group sing Shake, Rattle, and Roll.
We had people singing in parts, different musical parts that kind of fit together, and I think everybody had a great time. There's a lot of energy.
Rattle and roll. Shake, rattle, and roll. Shake, rattle, and roll. Shake, rattle, and roll.
find amazing is when elders, when all of us listen to music, when we sing, is we do come alive. And so when you see people that we might think are disconnected from life, actually they're very connected when they hear music, when they're singing, when they're a part of that. And to me, it really is amazing how people just become so alive.
So I'm going to invite Marianne up here to do something with you all.
Guys, here's where you come in, because I need your help. And you're going to have a bass line, and here's the bass line. And Eddie, you got to lead this for me. It goes boom, ba-da-da-da-da, boom, ba-ba-da-ba-da, boom, ba-ba-da-da-da-dum, da-da-da.
The power of music is
So
an amazing thing. We talked today a lot about the different benefits of singing. And so from social stimulation to physical improvements through breathing and core strength, verbal stimulation for people with dementia, it helps create new synapses in healthy areas of the brain that aren't yet affected by dementia. If we can continue to help people understand these very real benefits, then more people, I think, will engage in these healthful practices of creativity.
I've got sunshine.
I personally feel like I was invited, and that gives me the value of thought along with participating as well as just being here. And that gives me a little relief because I feel better.
When people sing music that they know, they relate it to experiences they've had in the past.
Well, I felt good about the singing because my husband was a guitar picker and it makes me remind of him. I was married for 52 years.
The goal of our workshops is so that more music and arts are taking place for more people in more communities, in congregate care settings and other community settings where people with disabilities and other challenges might gather. You know, we're hoping that more artists and caregivers are inspired to add the arts to their programming, to sing in the morning when they get up or when they get into work, to turn on the radio, to bring out the paints.
You don't need to be a gerontologist, you don't need to be a music therapist to be able to do these things. It's very natural. And so we do hope that people bring that back from these workshops.